Our doctor for Methodist Hospitals in Northwest Indiana tested positive for COVID-19. Meanwhile, nurses on the front line say they are unprotected because of the surgical mask shortage. Our Jermont Terry live at the University of Chicago, where nurses spoke up. Jermont.
Brad, nurses here and throughout Chicago insisting that they're being forced to work without proper protection. Members of the National Nurses United stand in solidarity outside the University of Chicago hospital Friday night.
So we're here to sound the alarm.
What's alarming to these nurses? The lack of essential medical supplies they are missing.
I'm asking the CDC and the government to step it up.
The N95 mask is the safest to protect nurses and doctors from the spread of the COVID-19 virus, but nurses say they can't get a hold of them.
But we just don't have enough. We're not getting shipments of supplies in.
The supplies are dwindling across the country, and in some cases, nurses are reusing the same mask for days. Others are simply improvising with what's around them. It's leaving healthcare workers here in Chicago feeling uneasy to step foot in a place where they know they are needed.
We are absolutely ready to go in and help our patients and save lives.
But Rebecca Abraham, a registered nurse, says she should not have to choose when it comes to health.
We'll do what we have to do, but we're asking, federal policymakers and state policymakers, please don't make us choose between our own lives and the lives of our patients.
The group outside the University of Chicago not placing blame on the hospital. They believe it falls back on the CDC.
They've basically put gasoline on a dumpster fire and left us to put out the flames. The hospital I think they just got caught in the middle.
Now, the nurses here at the University of Chicago say that the limited supplies that are here inside the hospital are being kept under lock and key. Reporting live in Hyde Park tonight, Jermont Terry, CBS 2 News.
Thank you, Jermont. New at 10.